Cancer cachexia is a particular type of weight loss where there is progressive and involuntary loss of lean muscle mass. Refractory cachexia refers to the stage where reversal of the weight loss seems no longer possible. At present, there's no recognised treatment for refractory cachexia, but we know from previous research that refractory cachexia can have a massive impact on both patients and their family members, and it can impact on them biologically, psychologically and socially. We know from previous research that cancer cachexia is under-recognised and underdiagnosed. Patients and family members have themselves told us that when they reported the signs and symptoms of cancer cachexia, that they were met with silence by healthcare professionals. And healthcare professionals have also previously told us that they didn't know how to best manage refractory cancer cachexia. We set out to design an intervention for patients with advanced cancer who have refractory cachexia and their family caregivers. And the aim of this intervention was to improve quality of life for both patients and their family members. We designed the DVD intervention in collaboration with our clinical colleagues and also with past carers who had cared for someone who had cachexia. And we also took on board previous research within this area. The DVD intervention started with a brief introduction to what cachexia is in advanced cancer patients, and then was divided into two particular sections, one for patients and the second section for carers. We asked both our clinical colleagues and also the previous carers to help us design the content of the DVD. We also asked them to give us feedback once the DVD was developed, and from this feedback they were able to tell us that they felt the DVD was very useful to help explain cancer cachexia and what it was and what its impacts were. In particular, past carers felt it would have been really useful for them to have this DVD whenever they were caring for their loved one with cachexia. And healthcare professionals told us that they felt the DVD would be really useful for them as it helped raise awareness of what cachexia actually is. Due to the huge impact that cancer cachexia has on not only patients but also their family members, this research is really important, as we would hope that this intervention will help us educate healthcare professionals about how to recognise, how to respond to and how to manage cancer cachexia. In future research, we would like to use this DVD intervention to assess its impact on cancer cachexia management in clinical practice. We would hope that if it positively influences clinical practice, that this in turn would help patients and their family members cope with the impact of cancer cachexia. We have also worked with senior cancer colleagues in both the Mayo Clinic in America and also St Vincent's Hospital in Australia, and we have collected data from healthcare professionals working within these areas on how cachexia is managed. From this work, we would hope to see if the DVD intervention that we have developed as part of this study would be useful internationally to improve the management of refractory cancer cachexia.